The global medical isotope crisis began on May 18, 2009, when Canada announced that its nuclear reactor in Chalk River, Ontario, would be closed for repairs for at least 3 months. 3 months later, the government extended the shutdown, telling the world that medical isotope production would not come back online until 2010. Canadian-produced medical isotopes are used in some 50,000 nuclear medicine procedures per day worldwide, including 5,000 procedures per day in Canada. Here are some viewpoints directly from those working in the industry on the ongoing medical isotope shortage.
It's just one of these things that as Canadians we should be saying this is an essential part of our health system and the government should be providing essential services. And the federal government regulates this, so they should be ensuring that we have the ability to create these radioactive isotopes here in Canada so we get the use of them quickly and right across the country.
If your radio tracers are not readily available, the scans are not readily available. So the doctor is left with either having you wait longer, choosing a similar test but perhaps is not as good, or perhaps choosing a test that's definitely not as good. So as Canadians, I think we want the best tests for whatever our diagnostic problem is.
Yeah, I go to the doctor and I ask and they tell me, we don't know. Well, you could imagine what it does to us. Then I go back home and I just live in pain, and I live in pain. And I try to have help, and nobody knows. We got to have a diagnosis. We got to know exactly what's wrong.
So May and June was terrible. We were not able to meet emergency procedures on a regular basis, and that did place people's lives at risk because in some situations the nuclear medicine procedure was the only procedure they could have to make the diagnosis, and some of these diagnoses, such as blood clots in the lung, have a high mortality rate if they're not diagnosed effectively.
And I think fundamentally what patients are expected to receive, or what we owe them, are tests, are excellent diagnostic tests that will get them the results that they need so that they can then be further treated. Cancer to me is just a word. I knew I was in pain, but I would have liked to know exactly, even at that time. Indecision and all this, it's not good. It only increase your fears and your anxieties. And in a case when you're sick, you have to put that aside. You have to be sure of where you're going.
Because the province here in Ontario, for example, has now put a policy in place of trying to get cancer treatment started very quickly. Because the sooner it's started, particularly with aggressive cancers, the more likely you are to have a good outcome. And if there's any delay at all, it can actually mean your life.
The other issue we're looking at is the cost associated with this. It's much more expensive to bring in the isotopes from South Africa and Europe as compared to a North American and a Canadian production capability because of the layers of complexity in bringing those isotopes into Canada. So we are facing increased healthcare costs if we are dependent on obtaining isotopes from halfway around the world.
On n'a pas expliqué à la population canadienne qu'on était en train de les brader, c'est-à-dire de leur priver d'une technologie extrêmement importante, très avancée, et d'exportateurs qu'on était, tant au point de vue de la technologie, de la connaissance, et aussi de produits absolument essentiels pour les malades, pas juste au Canada, aux États-Unis, mais au Japon, en Amérique du Sud. Et ces pays-là comptaient presque à 100% sur le Canada. Et soudainement, sans même les aviser, on les abandonne. Et on leur dit, bon, ben, le Canada se retire de ce secteur-là. Et là, on s'est retrouvé avec une crise internationale dont le Canada était vraiment responsable au début.
And it's a question of not only saving Canadian lives, but also positioning Canadian business to bring home the revenues from providing that same services to the world. And that's the choice that Canada is faced with as a public, it's a public option, is how do we proceed? And what role does the government play, and what advice does the public have for the government?
Many countries throughout the world have looked at Canada to help treat their patients as well, using Canadian technology, using Canadian medical isotope production in a way that's very cost effective. And so right now we do not know what will be happening, and that creates uncertainty and a void which we should not be in.
I think the patients have to come first, and what the medical community needs is to know that their patients will come first. So if it is additional funding, if it is facilitation, if it is ensuring communication, or whatever happens, that has to happen for the patients.
The government has left the Canadian nuclear industry unsure about Canada's future in nuclear science, research, and development. Visit us again soon to find out what experts and industry leaders are saying about the impact of the isotope shortage on Canada's economy and our reputation worldwide. Voice your opinion on the medical isotope shortage. Contact your local Member of Parliament to let him or her know why a secure, stable supply of medical isotopes is important to you.